Hello, my name is Art Riggs. I'm a certified advanced rolfer and massage therapist, and I've been teaching massage for over 15 years. Welcome to Deep Tissue Massage and Myofascial Release, a video guide to techniques, which is the companion for the book Deep Tissue Massage, a visual guide to techniques. We are about to embark on a 10-hour journey of massage, which is designed for experienced massage therapists. It is important that you use these tapes in such a way to maximize your learning. So please do take the time to look over the enclosed booklet for suggestions on how to get the most out of these tapes. Information will be built upon itself, so tempting as it is to spend time looking ahead at the areas that you're particularly interested in, please take your time to view these tapes in order to cultivate your touch and learn the early stages of information that the later stages will be built upon. I hope you have an informative and fun journey with these tapes. This video is divided into 3 sections. The first section is the fundamentals section, where we'll really focus in on your touch, the tools that you'll be using, fingers, knuckles, elbows, forearms, fists, to use in your work. The second section will then move with these skills that you have built into having protocols and strategies to use in your sessions. The last section will deal with troubleshooting and dealing with injuries, which is something that a lot of my students are very, very interested in when they get into their practice and having people come in with problems. So when you're viewing these tapes, please watch very slowly and into small sections. I provide a lot of information and I would not expect you to learn this in 1 or 2 seatings. It's best for you to practice with someone, push stop, and if you have a table right there, work on these sections as you're moving through the series. One of the most important buttons you have when viewing this would be the rewind button. Please do take the time to see if you can notice the changes in the tissue. If you have any questions about the way I'm working, push stop and rewind and review the tape. I make a real conscious effort to keep away from giving rote descriptions of strokes. My main goal is to stimulate your thought process and for you to be able to express your individuality. So because of this, I'm going to be offering you many alternatives to use for strokes, far many than you would be using in a single massage. And different people, different massage therapists will gravitate toward different strokes, and different clients will like different strokes. So please realize when I'm demonstrating that because I have so much material, I'm working much faster than I normally do in my practice, and do take that into consideration. One other thing that I think is so important when you're doing these strokes is to have a firm knowledge of anatomy and how the body works. We'll be doing a lot of work moving bodies through different ranges of motion, and just because of time limitations, it's really impossible to go into too much anatomy during this series. So please find an anatomy book that you're really comfortable with that can help you out with some of the kinesiology and the muscle attachments. An excellent book that I have found is Trail Guide to the Body by Drew Beal, and this is just an absolutely wonderful book. So I would highly recommend getting this book to give some clarity to your work and an understanding of the anatomy behind the moves. I'd like to talk a little bit about the quality of your touch. Whenever I teach classes, one of the first things I do is ask my students how long it takes them to realize when they're getting a massage from a brand new massage therapist, how good the quality of the massage is going to be. Invariably, 1 minute to 2 minutes is all the time needed for these students to determine how good the massage is. This is before they've had any fancy strokes, before they've had any particular problems dealt with. It basically comes down to how do you contact the tissue that you're working with. I'd like to discuss a few of the factors that influence touch. There are many more listed in the book, but I want to talk about a few that I can demonstrate. One of the first is, how hard are you working? If you're working too hard, your hands will be tense. As soon as you find yourself shaking, if you find your fingers hyperextending, if you find another joint bending that you have to tighten against that, then you're working too hard. The basic theory that I'll be trying to get across here is, as you find yourself straining, you will move to another tool or get a different body position so that it becomes easy for you to work. Another factor is the angle at which you're working. If you're working too directly down into tissue where you can compress it against bone, this is particularly interesting and important in the area of the gluteals because you have the sciatic nerve running deep to them. As soon as you start pushing down and start using the sharp points of your fingers, it's not going to feel good. Even if you're using the knuckles. Any other tool that you point down into the tissue is going to be strained and you will feel the body recoil against you. What you want to do is sink to the level at which you're working and then work at an oblique angle or a diagonal. I very often am working at 10, 20, at the most 30 degrees for almost all of the work I do. Another major factor in the perception of depth is actually the speed at which you're working. Oftentimes when clients complain or you find them tightening against your work, they mention that you are working a little bit too deeply. You're actually not working too deeply, you're working too fast. And it does not give the client time to adjust to the work you do. So if you're moving in fast strokes and you feel that you're straining or that the client is not relaxing against you, it doesn't mean that you're working too deeply. It only means, in all probability, that you need to slow down. Basically, your stroke is going to be a combination of the depth at which you are working and the speed at which you are working. If there's one thing that I could change in the first 5 to 10 years of my work, it would be that I worked less hard and tried to work with tissue rather than on tissue. So whenever you're straining, back off, go easy on yourself, go easy on your client. You'll both be grateful. Another factor I'd like to mention in the quality of touch is the amount of lubrication and the kind of lubrication you use. Most students, when they first come out of their initial massage training, use literally 4 or 5 times too much lotion. A lot of times I don't use lotion at all and can just work with the natural oils of the body. If you use too much lotion, you're going to be sliding over the tissue and almost giving the feeling of a rolling pin, just compressing tissue. So what you want to be doing is, rather than compressing tissue, you want to be stretching tissue. So be sure to use your lotion sparingly, just enough to have your hands be able to grip the skin. Always remember to be doing work when you're putting the lotion on. Sometimes I feel like I'm a roast being basted. People throw on a lot of oil or a lot of lotion and they are just slathering it around on my skin rather than accomplishing something. It's much better to add lotion 2 or 3 times and actually be doing work when you're applying the lotion. The main benefit about not using too much lotion is having the ability to have your hands sink into the level at which you're working and then move in a diagonal and visualize that you are pulling taffy. That what you're actually doing is finding tight muscles, finding where the restriction is, and trying to soften those by stretching them rather than just rolling over them. This will change the quality of your touch, probably more than anything that I will talk to you about. I'd like to expand on a concept that I just previously mentioned, which is the idea of sinking through tissue and then working at the level, however deep that is, that your intention is focused at. I want you to be sure to do this exercise. This is a palpation exercise. It's not teaching you a stroke. So if you don't have somebody there to do this now, mark this down so you can practice this with whomever you trade with or anybody around the house that you happen to be in contact with. I'm going to talk a little bit about working on the soleus muscle or palpating the soleus muscle through the gastrocnemius muscle. The gastrocnemius muscle is a two-joint muscle which crosses the knee here, so that if I bend the knee up to 90 degrees or even less, the gastroc is going to be relatively soft. And this isolates the soleus muscle so that if I dorsiflex the ankle, I'm stretching the soleus muscle. So all I want you to do is to put your client's foot underneath your axilla here, where you can actually flex the foot and still use both hands to work. Remember, all we're doing is actually palpating here. So what I'd like you to do is find a nice, fairly soft area through the gastroc muscle. It may be on the outside, it may be on the medial aspect, or it may even be in the septum between the two muscle heads. And let your hands slowly sink through that gastroc muscle until you feel some resistance. It might be a ½ an inch, it may be 3/4 of an inch down, and that will be the soleus muscle. And what I want you to do is hold your hands at that depth and then dorsiflex the ankle by leaning your axilla against the front part of the foot, and you should feel this soleus muscle coming up to meet you, almost like it's a rubber band that you're stretching. If I wanted to exaggerate this a little bit, I can actually grab this soleus muscle through the gastroc, and as I flex it, I can feel it stretching and moving my hands as I stay on contact there. One image I sometimes give with this is the idea of a frozen stream, and the outside would be the gastroc muscle or the ice over the stream, and then you can just feel this movement of the water, which would be the soleus, underneath as you sink through this. This is a very important concept to grasp, because anywhere you work on the body, you are going to have to determine what level you're working at, and it may be very important for you to work through superficial layers so that your work is focused at a much deeper layer. Deep rotators of the femur. Notice the direction of the deep rotators of the femur, and particularly the piriformis muscle, and the difference in direction between them and the gluteus maximus, which lies superficial to them. Also notice the sciatic nerve. The hip rotators, piriformis being probably the most important, quadratus femoris is also a very important one, move from the lateral border of the sacrum and go to the trochanter here, and when they contract, they externally rotate the leg. So as they shorten, they pull this femur this way so that it rotates. So they're moving this way, and above them you have the gluteal muscles moving this way as a hip extender. What I want you to do is to try to sink through the gluteus muscles very slowly. Just let your hands slowly sink through that. Keep them soft and don't force anything. And then you should be able to, as you feel resistance, sometimes an inch or two down, you should start feeling a different quality of tissue there running in a different direction. If you move your hands from right to left, you can almost feel the peaks and valleys, and you may be able to really focus right on the piriformis muscle and notice if it's tight. So once you've sunk into this level, bend the knee to 90-degree angle. Be sure that you keep it at 90 degrees because the knee is fairly stable as you use it as a rotational force here. Keep your hands sunk in there, and notice as you move the leg into external rotation, you will feel that piriformis or other rotators actually shorten and soften. As you move back to neutral, you'll feel them starting to stretch again. And as you move into internal rotation, which is stretching those external rotators, you'll feel them like that rubber band getting tight, coming out to meet you, and you'll feel a different quality there. These descriptions that I'm giving sound quite easy when I'm showing them, but they're much more subtle than I'm implying right here. So take your time, feel this, and don't be too hard on yourself. A lot of times students expect to have very profound feelings of the piriformis through the gluteus. If you think you feel it when you move the leg, that's it. And then later on in later tapes, we will talk about how to actually work on the piriformis to stretch it and release it. One of the issues of biomechanics that I hear talked about in videotapes and in a lot of classes is what table height to have. I will mention that when all of you have your own private practices, having an automatic electric table and a chair, if you do seated work, that has an adjustable height to it, will really obviate a lot of these questions we're talking about right now. Most often I hear people talking about with your fingers slightly curved that they should just be able to just barely touch the table. I think this is a fine basic plan to work with, but the reality of doing massage is that the person you're going to be working on may be 2 to 3 inches taller or higher at their gluteal area than they are at the ankle area. You may be turning them on their side. So I think a lot of times in classes I see students going to great trouble to get in the middle of a massage to change the height of the table and raise it 1 notch when they're working down on the legs, and then they move up on the gluteal area and the table's too high. So I don't think it's nearly as important as a lot of people try to make that out. One of the other issues that you have to deal with is if your back is your weak point, you may want the table to be a little bit higher so that you're not leaning forward. If you have shoulder problems, if you have thoracic outlet strain, then you may want the table lower so that you can lean into it here. You can see if I'm working on the ankle here and the table is at the right height, as I come up to the gluteal area, it may be too high, and you may see that my shoulders are rising up and I'm having to muscle it here. There are a couple ways that you can deal with this. One is just get a little bit different angle and step back and have your force be coming from your legs so that you're still working in an oblique angle and the table is the right height. One of the other things you can do is if you feel your shoulders are working too high and you're straining here, it's a very simple thing to just climb up on the table and work from your knees so that you're to the right height and you're using gravity to work for you. The other alternative, if you're finding your hands are that the table is too high and your shoulders are strained and you're bending your elbows, all you need to do is change tools. You might actually lower your body, use gravity, and move in to using your elbow here. The basic principle that I want to get across is you should always feel at ease when you're working. Catch those strain patterns and change. Very often I see people's feet getting stuck so that as they extend beyond their power range, they are afraid to move their feet. All you need to do, if you're too low and you want to get a little bit higher and use more gravity, is just move your body a little bit closer. The biggest error I probably see with biomechanics is that people are working too close. They have bends at their elbow, at their wrist, at their shoulder, and they're muscling. All of the force as I work on Dina here is coming from muscular activity. That's going to wear me out, and it's not coming from a strength core area for me. All you need to do is step back, push off your feet, and lean, and now everything is coming from my feet. My arms are extended in a relaxed, extended position. My wrist is relaxed, and I'm putting in about half the muscular effort that I did before. The alternative to this that I do want to mention, however, is the problem of extending yourself too far. So sometimes I see people doing a very powerful stroke, and the emphasis on making long strokes and continuing for continuity as they extend up, I think you can see right now, I have no power. I'm not able to sink into a deep level on the hamstrings here. I've passed beyond my use of gravity. So all of the force is from my legs, and I'm working at way too oblique an angle to really contact her deeply here. One of the things that I encounter in my teaching of deep tissue classes to relatively new students is that they have a lot of trepidation about working around the body in areas that they're not used to. And I think it's extremely important to have a very firm anatomical knowledge of the body in the areas that require caution. But on the other side, you also need to be able to work around these areas because they're often the center of a lot of the problems our clients have. So let's spend a little time with Joel, my anatomically correct model, who also keeps me very honest when I'm doing my work about not trying to force things or muscle things, because when you're working with very strong or large clients, it's a perfect time for you to work on your biomechanics and learning how to work with tissue instead of forcing tissue. So let's move down to some of the areas in Joel's feet that I would be exercising some caution on, okay? One of the first areas is that you'll find people come in to your practice with sprained ankles rather soon after spraining ankles. And this is a great area to work on. We'll talk about this in the troubleshooting and injuries tapes. But I do want to mention one particular area for caution, which is the anterior talofibular ligament, which runs from the talus bone up to the fibula here. And it's the main ligament that keeps the foot from turning out and getting inversion sprains, which is the most common sprain. So the only thing I'll mention about this is a great area to work after the ankle has started healing and you're sure there's no serious damage. But if a client has just sprained their ankle, one of the things that can happen is this talofibular ligament can actually be pulled away from the bone, either at the fibula or at the talus bone, and it needs to reattach itself. So you're not going to be wanting to move this area or work really hard on that ligament. However, after the ankle is healed to a certain extent and you found out that there's no serious damage here, then this is an excellent area to work because it will become very fibrosed. The only other really area that I want to talk about on the foot that is important is the second metatarsal particularly, but any metatarsals, there can be a condition called neuromas. And clients will sometimes come in and they've been to the doctor and they say they have a neuroma. And basically, it's a nerve that gets compressed between the metatarsal bones. The most common area is over here in the second metatarsal. And one of the causes of that is that the metatarsal bone actually just drops. Now, we'll be talking throughout this tape about ways of mobilizing bones and moving them. And this is one area, if somebody does have a neuroma or a lot of pain here, you do want to mobilize so that these can move if they're fixated, but you're not going to want to be forcing the metatarsals down relative to the metatarsal to its left and right. So this is an area you just want to be a little bit careful of. Let's move up the leg to talk about some of the areas on the back of the leg that require some caution. The back of the leg offers another chance to talk about some areas that require caution, but that also can really be worked on to alleviate some symptoms your clients may be complaining of. One of the things that I find is that there's a large difference between working carefully and with confidence and working very timidly and hesitantly. So I, in the book, mention my example of walking into a dark room, and if it's your own house and there's no lights on and you're familiar where the tables are and the television and chairs, you can navigate your way very efficiently but slowly and carefully around those obstacles. However, if you're in an unfamiliar environment and there are no lights on, you're going to be very unconfident and also probably have some trouble navigating. So what's really important for you is to learn your anatomy and not be afraid of these areas. Take classes, get your skill level up so that you can work around these areas and do it with confidence. Let's take a look at the back of the leg here and talk about a couple areas around the knee. The first area I want to talk about is right behind the fibular head is a branch called the perineal nerve, which is a branch off the sciatic nerve. And this is an area right up behind the head of the fibula that you want to be very careful of. What you want to be able to do is to distinguish the feeling in tissue between nerves, between blood vessels, between fascial restrictions or adhesions. So this is an area that you can accomplish a lot on. We'll be talking about this in the tape, but just be cautious right behind the head of the fibula. This is another area that you're going to want to be watching. Another area is behind the knee in what's called the popliteal area. And this is an area that very often in early massage classes students are told to keep away from. And I think that's wise advice until you have distinguished between these different feelings of nerves and veins and where what healthy tissue feels like. But it also is an area that carries great strain in the body and you want to be able to work around. So one of the things that I do in the back of the knee in the popliteal area is I just bolster the leg to soften this. All these tissues will be in less of a stretch, and I put on a fairly severe curve to the knee here so that this area is much softer and you'll be able to feel what's going on in here. You do have the popliteal artery and you have the popliteal nerve right in this area. And arteries are always very easy to feel because you'll feel their pulse. And we'll talk more about some other larger and more important arteries, but what I do is when